Recovery after abdominal liposuction involves compression and patience. So there's not much you need to do except wear your compression garment. You can wear Spanx, you can wear the garment I put you in. Basically what we need to do after liposuction of the abdomen is just compress that area, give it some gentle compression so that your thinner layer of subcutaneous fat, because it's much thinner after liposuction, heals down against your muscle layer. So in other words, that fat layer between your skin and your muscle has it's honeycombed. Think of it as being honeycombed. And what we need to do is collapse that honeycomb down so you have the flatter abdomen that you want. So that's the purpose of the compression, is to squeeze everything down after we've sucked out all that fat underneath. The little incisions will have maybe 1 to 2 sutures in them. They're tiny. The sutures will eventually dissolve, or we'll trim them or cut them out at one of your post-op visits. Exercise, if all you had done was liposuction, you can exercise after a week as long as you're wearing compression, and I would ease into it. You may have some pain. It's okay. You're not going to hurt anything as long as you're wearing compression and you sort of ease into it slowly. Showering, if all you had done was liposuction, you can shower after 24 hours. I don't really want you going underwater or swimming for 3 weeks, so no baths, lakes, pools, swimming for 3 weeks. But with liposuction, sometimes we'll make it an exception to that 3-week rule when it comes to swimming, because the incisions are so small that I may see you at your 1 or 2 week visit and say, you know what, you're healed enough, you can go swimming if you want. Now, liposuction skin looks weird right away. I shouldn't say it feels weird. So you will probably, once the bruising goes away, which takes about 1.5 to 2 weeks, when the bruising goes away, you're gonna look better because you're gonna look thinner because we sucked out some unwanted fat. But your skin's gonna feel funny to you. I've had liposuction done, and what the skin feels like after liposuction, it feels like numb, half numb cardboard. It has kind of this firm feeling. It's a little bit numb and it feels odd. But eventually that slowly fades away back to normal over time. So just be patient. I tell people, you know, the good news is you don't feel or experience the world with your abdomen, meaning it's not like it's your hands. So the little bit of numbness there isn't really a big deal, and it eventually fades away and gets back to normal. And that firmness that the tissues have when they're healing from liposuction, it feels a lot like cardboard under your skin. That is all that internal fat cells healing, because just like anything else in our body has to heal, when we suck out a bunch of fat out of the layer of fatty tissue in your body, that layer has to heal like anything else. And as it's healing, it's swollen, it's inflamed. You can't really see it, but you can feel it, and that's what's going on, and that's normal and it's okay. Time and compression really make that better. So I want you to wear compression for 2 months and then just be patient. Some people think that lymphatic drainage massages and massages help. They may, you can give them a shot, but I can assure you that with time, that firmness that liposuction tissue has initially will fade away with time. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.